let's talk about sciatica. Most people have heard of it, but we're going to talk today about what sciatica truly is and what it looks like when it presents. Okay. So first thing we need to talk about is the sciatic nerve. So sciatica, by definition, is inflammation or pressure around that sciatic nerve. Let's take a look at where we'll find the sciatic nerve. So it actually stems from the nerves that come out of the spine at the lower levels of the low back and the sacrum here. And it forms this nice big nerve about the size of your thumb in diameter. And it comes out of this little hole right in here, goes down the back of the leg to the foot. Let's take a deeper look at what that looks like. Here you can see a more anatomical breakdown of the lower back and the back of the leg where we find the sciatic nerve. So here is the back of the side of the pelvis, and you can see the femur bone and the hip bone kind of right out the side there. This little hole right in here is that same one that we showed you on the skeleton. That's called the sciatic notch, and that is where you'll find the sciatic nerve. So we're going to trace it here. It's this nice big thick nerve that comes down the back of the leg. It branches off a little bit, but we see it go all the way down to the base of the foot. So because that nerve comes out of this hole right in here, some common causes of sciatica would be some rotation of the pelvis, which will actually close down that space, which adds a little bit of pressure around the nerve itself. Another really common cause is inflammation of the muscles through the gluteal region and also the piriformis muscle. So studies have shown that most of the time the sciatic nerve runs under that piriformis muscle, but in some people it actually runs through the muscle. So when we get a lot of tension through the muscles in the low back and the buttock region here, it can add a lot of extra pressure to that sciatic nerve, causing some common signs of sciatica. So some common causes of sciatica would be pregnancy, weight gain, a lot of increased activity or a lack of activity. So we commonly see this kind of thing after a long road trip where you're stuck in a car for a while, if you're on your feet a lot for an activity, or as you introduce yourself back into exercise or different things like that. So another really common sign of sciatic-like symptoms would be that it actually feels better when you get up and move, and it hurts worse when you rest. The reasons for that is when we're up and moving around, we get more movement in the pelvis. When that pelvis is moving, we can alleviate some pressure on the sciatic nerve. So in your mind, when that hurts, we want to sit down and rest, and that typically with sciatica will make it worse. And so the key to it is to move, move, move. So how sciatica presents is different depending on each of an individual person. So commonly we see sharp pains, shooting pains, burning pains, achiness, but it can be kind of a variety of those things depending on how your body is affecting that nerve. So commonly we'll see those symptoms low, actually not so much in the low back, more so lower into the buttock region, right in the center of that area. And then we'll see it kind of follow that same pattern that we saw when we looked at the sciatic nerve, that it can come down the back of the leg, down to the foot. Sometimes it's even just stays right in the hip area. So that classic presentation doesn't actually exist with sciatica. It kind of depends on how it's presenting for each individual patient. So here in our office, when we're dealing with a sciatic presentation, the first thing we want to do is differentiate what's causing it. So is it pressure around the nerve from that pelvis not moving, or is it irritation in the muscle? Now, most commonly, it's a little bit of both. And so we want to target it from both angles there so that we can actually get relief. So our first step is always, always, always to adjust that pelvis. Make sure that the pelvis is moving properly so that we get that pressure off the nerve as quickly as we can. The quicker we do that, the quicker we can get those symptoms to go away. And then from there, we really want to focus in on those muscles. So we talked a little bit, we have our gluteus muscles that kind of cover the back of the buttock there, and our piriformis muscle, which covers this on a more of an oblique angle there. It's really important to keep those muscles moving. Now, first instinct when you're having these symptoms is to stretch it all out. You want to be careful with that because of how that nerve runs, stretching those muscles too much can actually further the irritation of the nerve. So, like I said, first thing we want to do is adjust the pelvis to get it moving, and then we'll slowly introduce those stretches and exercises to help keep things stable and eliminate the inflammation. So we're going to show you a few exercises and stretches that you can do at home to help alleviate some of these symptoms. Okay. Okay, so the first thing we're gonna do is we're gonna do just some basic stretches. You can do these on the floor, you could do them in bed, you can do them on the couch if it's firm enough. So the position doesn't really matter as long as you're getting that movement. So we're gonna start, and we're gonna lie flat on your back. And the first thing we're gonna do is called knees to chest. And so you're gonna pull just that one leg up towards your chest, just a little bit, not a ton of extra pressure, but just to get a nice stretch through the low back and the buttock region. And we relax, and we're going to do the same thing on the other side. So a very common mistake is to only stretch the side that hurts. Always want to make sure we balance it out so that we keep both sides nice and happy. When that gets easy, we can change it a little bit. So with this one, we're going to bring that knee up towards the chest, and then we're going to bring that foot up towards the air. And that's a little tougher, okay? We're going to do the same thing on the other side. Good. Now, a progression from there is to bring both knees towards the chest. So with this one, we're going to do a nice big pull. And you can feel that whole low back stretch out. If stretching, pulling the knees to the chest alone doesn't give you the relief that you're looking for, another good option is utilizing what's called a stretch strap. And so you can see this is a nice long strap that has these loops in them, and they're not stretchy. So it's a nice firm strap, and it's going to allow us to add a little extra overpressure for our stretches. So we're going to start, I'm going to put my foot through one of those loops there. And we're going to use the handles on the end of the strap to give us a little bit of extra movement. So you can see I can move my leg a lot further with the assistance of the strap versus just using my arms. So you want to be careful not to stretch to the point of pain. So a little bit of stretch and discomfort is okay, but I don't want to stress to push everything further than it needs to. So again, we have that knees towards the chest. We're going to keep that leg bent. And then as that gets simple, we can again extend the leg up and do a little pull. And then again, we can do that double knees to the chest with a little overpressure. And we can also do both legs extended with the assistance of that strap. Another progression from just basic stretches would be utilizing a foam roller to alleviate some of the pressure through the gluteal region. So be careful with this one. If things are inflamed and you're in a flare-up of sciatica, this can actually increase the inflammation to the area, causing increased symptoms. So this is more of something we want to do after things have settled down or more as a preventive. So we're going to utilize a foam roller. I'm going to lay it on the floor there, and I'm going to start not quite on my side and not quite on my back. So we're going to start through the lower hip region, and we're going to be kind of at a 45-degree angle. So we're hitting right through the meaty part of the gluteal region. So I'm going to keep my lower leg bent a little bit. This gives me some stability. If I throw that out there, it's a little more difficult for me. So we're going to keep that bent. You can keep the other leg straight. And we're going to stabilize with the hand, and we're going to do just a little roll through that area there. So nothing too extreme. As that gets simpler, you can change your angle a little bit. And we can lean a little more towards the flat part of the back. So one last stretch that's really good for sciatica is what's called a pigeon pose. So this is a yoga stretch that's very comfortable. You want to be careful with this if you have any history of knee issues or hip issues, especially if you've had a joint replacement. So if you're having trouble with it or you're worried about injuring, come talk to us and we'll show you some easy ways to modify it. So with this one, we're going to take the leg that we are trying to stretch. So if I'm going to stretch my right hip here, so I'm going to come down on my hands and knees, and we're going to tuck that right leg up forward so the lower leg falls right under the chest. Now the key to this is making sure we keep that back leg nice and straight behind us to avoid any twisting in the pelvis. Now once you're here, you'll feel a nice stretch through the lower part of the glutes on that right side. And if that's comfortable, you're going to go ahead and lean down forward to get a deeper stretch. You want to remember, we always want to stretch both sides so that we don't create or promote the imbalance in the hips. So again, like I said, be careful with that stretch if you have any knee or hip injuries in the past. And that's a pretty advanced one, so not something to do when you're right in the middle of a flare-up. I hope we've answered all of your questions regarding sciatica. If we missed anything, please let us know.